If your chest looks like this or like this, then you may have gynecomastia. What exactly is gynecomastia? Gyno, as we also call it, is an enlargement of the glandular tissue in the male breasts. So essentially, there's breast tissue in your chest that isn't supposed to be there. How do you get gyno? There are many causes for gyno, and it's actually quite common, so there's no shame in it. A lot of men between the ages of 18 and 55 actually suffer from gynecomastia. It can happen because of hormones, it can happen because of lifestyle, it can even happen because of some medications. Of course, every case deserves a unique approach, and that's why we have 4 main methods of removing gynecomastia. The first method is just liposuction, which would be something like this. If liposuction alone isn't enough, or if there is more gland tissue, then your surgeon might opt to go with a small incision to remove the gland tissue. Those 2 options can also, of course, be combined. The fourth option is where if there is also excess skin or the gland tissue is so big that there also needs to be an incision made to make sure that there is no loose skin, or if loose skin needs to be removed. Depending on your individual case and also the size of the actual gland tissue, your surgeon will recommend you whether or not it's possible to perform the procedure under local anesthesia in your clinic or under general anesthesia in the hospital. Because if there is too much tissue to be removed or if loose skin is involved, then your surgeon will suggest you to opt for general anesthesia in the hospital for your safety and the most efficiency. So if we're going to do surgery for gyno, are we going to remove 100% of all the breast tissue? And the answer is, it depends. In some cases, it can and it will be 100% removed. But your surgeon will assess to also make sure that your result is aesthetic. Because depending on your anatomy, if you were to remove 100% of the tissue, there is always a possibility or a small chance that you might end up with something that looks like this, which is obviously not the desired aesthetic result. So your surgeon will assess and might leave a small bit of tissue behind the nipple to make sure that your chest still looks natural after the surgery has been performed. How long will it take for me to recover? If you've had gyno surgery, then the recovery is pretty fast, depending of course on the severity of your case. If the liposuction technique or the combination of liposuction and gland removal technique have been used, then you're usually looking at about 4 to 6 weeks until a full recovery. And by 4 to 6 weeks, I mean until you're cleared to be active again and, for example, go to the gym. Because that's a very common question is, if I get surgery for gyno, when can I work out again? And the answer is, once your scar has been fully healed, your stitches are out, and the inside of your body is also okay. And of course, last but not least, the Introplast team will take amazing care of you. We're known for excellent aftercare. And obviously, if you're from abroad and you're planning to come to Thailand to get gyno surgery, don't forget to enjoy the weather, the good food, and make a few friends. We'll see you soon.